Now we will discuss automated external defibrillator for adults and children 8 years of age and older. This device is a lightweight, portable, and computerized device that can identify an abnormal heart rhythm that needs a shock. Then the AED can deliver a shock that can stop the abnormal rhythm and allow the heart's normal rhythm to return. AEDs are simple to operate. They are designed in a way that healthcare providers and bystanders can attempt defibrillation safely. AED identifies abnormal heart rhythm as shockable or non-shockable. Shockable rhythms are treated with defibrillation. Defibrillation is the medical term for interruption or stopping an abnormal heart rhythm by using controlled electrical shocks. The shock stops the abnormal rhythm. This resets the heart's electrical system so a normal, organized heart rhythm can return. And of course, if effective circulation returns, the victim's heart muscle is once again able to pump blood. And we will feel palpable pulse. This is what we call return of spontaneous circulation or ROSC. Signs of ROSC include breathing, coughing, or movement and a palpable pulse or measurable blood pressure. So this device is talking with us. This device is saying us what to do, and we need to listen. When we attach the pads, the device should analyze, and then it says, shock advised, no shock advised. Resume chest compressions, clear the patient. So we need to listen everything that AED device is saying. Early defibrillation increases the chances of survival from cardiac arrest that is caused by an abnormal or irregular heart rhythm. We know that our heart works with the help of the electrical stimuli. And if something happens, the arrhythmia can occur when the electrical impulses that cause the heart to beat happen too quickly, too slowly, or erratically. Two life-threatening, shockable arrhythmias that cause cardiac arrest are pulseless ventricular tachycardia or PVT and ventricular fibrillation. Of course, for BLS examination, you will not be given a ECG to identify. I just put it here to show which one is which. AEDs should be properly maintained according to the manufacturer's instructions. Someone should be designated to maintain the battery, order and replace supplies including AED pads, adult and pediatric, replace used equipment including barrier devices, for example pocket masks, gloves, razors, and scissors. Now let's talk about AED pad placement. If you look at the pad, there are diagrams and pictures where to put that pad. So if you have never seen any AED device or the pads, actually you just need to look at the pads. It's just very simple pictures. You can see how it is shown in the first image. The two common placements are anterolateral and anteroposterior or AP. Anterolateral placement, as shown in the image, place both pads on the victim's bare chest. Place one pad directly below the right collarbone. Place the other pad to the side of the left nipple, with the top edge of the pad a few inches below the armpit. For anteroposterior placement, place one pad in the center of the victim's bare chest, which is the anterior, and the other pad in the center of the victim's back, or posterior. Now let's use the AED. Begin by opening the AED. If needed, power it on. During a resuscitation attempt, follow the AED's prompt. Once again, this device will say us what to do. Attach the AED pads to the victim's bare chest. Avoid placing the pads over clothing, medication patches, or implanted device. Choose adult pads for victims 8 years of age and older. Use child AED pads younger than 8 years of age. Do not use the child's pads for an adult. because the shock dose will be too low for an adult. First, we will peel the backing away from the AED pads and then attach the adhesive AED pads to the victim's bare chest. Attach the cables to the AED device. Some may be already pre-connected. We shout "clear," which means that no one should touch the patient. And we will let the AED to analyze. We are not moving, we are not touching, we're not doing chest compressions. We're letting the device to analyze. Some AED will tell you to push a button to allow the AED to start analyzing. This will take a few seconds, and then the AED will tell you if the victim needs a shock. If the AED advises a shock, it will tell you to clear the victim, and then we need to deliver a shock. We should shout, "Clear the victim," or "Everybody clear," or "Do not touch the patient." In hospital setting, we need to be sure that no one is not touching not only the patient, but the bed and everything that is connected to the patient too. When I did my residency in ICU, I saw a lot of students, when we're saying clear, they think that they do not need to touch only the patient. And they lean on the bed, they're touching their rails. It is very, very dangerous. Do not touch anything that is attached to the patient. And why you should not touch the victim during defibrillation? Because the electric shock can pass through your body, risking injury. Touching the victim can also interfere with the shock's effectiveness and prevent the AED from working correctly. Let's come back. We are making sure that no one is touching the victim. We will press the shock button, and the shock will produce a sudden contraction of the victim's muscles. If AED prompts that no shock is advised, or after any shock is delivered, immediately resume CPR. Resume CPR. This is one of the criteria that you will be assessed during skill test. You should not stop and you should not lose a second. You need to start immediately during chest compressions. After about 5 cycles or 2 minutes of CPR, the AED will prompt you to repeat, again, analyzing, checking if we need to shock, and again, continuing chest compression after shock, or if no shock advised, immediately. For infants and children younger than 8 years of age, we should preferably use pediatric pads. If we don't have pediatric pads, one common way to reduce a shock dose is by attaching a pediatric dose attenuator to the AED device. An attenuator reduces the shock dose by about 2/3. A pediatric dose attenuator frequently comes pre-connected to the pediatric pads. If we don't have pediatric pads or attenuator, we need to use adult pads. Of course, adult pads deliver a higher shock dose, but a higher shock dose is better than no shock. The placement is different. Some AED will require you to put the AP position, some anterior lateral position. For infants, it is mostly we use AP pad placement. Let's repeat one more time. For adults, we do not use child pads, but for children, we can use adult pads. One more thing, this you may see during your exam. Do not allow the pads to touch or overlap, and do not put the pads over the clothing. For infants, a manual defibrillator is preferred, which has more capabilities and that can provide lower energy doses that infants often need. Manual defibrillator is the one that we mostly see in the movies or in the hospital settings. BLS course is not covering how to use manual defibrillator. And we can see here images, the pads that show us where to put them. And in this image, we can see the attenuator. Okay, so today we're going to learn a new profession, which is hair waxing. There are several special circumstances when we need to do several additional actions to be able to place the AED pads. For example, when we see hairy chest, this, believe me, can happen and it is very common. We already said that we need to put the pads on the bare skin. You cannot put the pads if we have very thick layer of the hairs, so sometimes the AED bag has a razor. We need to use the razor and shave the area. If we do not have a razor, but do have a second set of pads, use the first set to remove the hair. That's where we become a waxer. We will press them down as they stick as much as possible and quickly pull them off. Then we will apply the new second set of pads. So sometimes when the pads are sticking to the hair and not the skin, the AED will not be able to analyze the victim's heart rhythm and will display a check electrodes or check electrode pads message. And we can see what AED first response kit can contain here: scissors, pocket masks, and here is the razor. Next, do not use an AED in water. If the victim is in water, pull the victim out of it. If the chest is covered with water or sweat, quickly wipe the chest before touching the AED pads. If the victim is lying on snow or in a small puddle, it's okay. You may use the AED after only quickly wiping the chest. Victims who have high risk for sudden cardiac arrest may have implanted defibrillators or pacemakers that automatically deliver shocks directly to the heart. If we place an AED pads directly over an implanted medical device, the implanted device may interfere with the delivery of the shock. As you can see in the image, these devices are easy to identify because they create a hard lump beneath the skin that is most often in the left upper chest. If it is possible, avoid placing the AED pad directly over the implanted device. The transdermal medication patch may interfere with the transfer of an energy from an AED pad to the heart. This could also cause small burns to the skin. Examples of medication patches can be nitroglycerin, nicotine, pain medication, or hormone replacement therapy patches. It is better to remove the patch and wipe the area before touching the AED pad. Make sure to wear gloves to not transfer the medication to yourself. Next, you should use an AED for a pregnant woman in cardiac arrest. Shock will not harm the baby. Without this shock and life-saving treatment to the mother, the baby will not likely survive. If resuscitation was successful, place her on her left side. That will help improve blood flow to the heart and therefore to the baby. So let's remember, we can do chest compressions over clothing, but AED pads should be placed only on the skin. And you do not need to remove a person's jewelry as long as it does not come in contact with the pads.